As a reminder, this is a public meeting and this will be recorded. I see that Avery has started that. Thank you, Avery. And with that, the chat feature has been disabled so that we are able to capture all discussion points as part of the recorded meeting. To make this meeting run smoothly too, we ask that any questions be directed towards the co-chairs or towards the grant staff like myself. My name is Casey Beck, and I'm a grant program coordinator here at the Criminal Justice Commission. Today, we will be presenting some legislative updates from our partners at the Oregon Health Authority, a summary of impacts quarterly data from this most recent quarter, Q3, and then there will be 2 agreement amendment requests from grantees that will require action from the Grant Review Committee. So today's anticipated meeting schedule is shown here. Please note that all times are very generous estimates. I imagine that today's meeting will probably not go the full 2 hours. So just wanted to make everyone aware of that. But before we take roll, I wanted to take a moment and welcome a new member to this Impacts Grant Review Committee who joined since our last meeting in February. So we are joined today by our new Oregon Health Authority representative, Samantha Byers, who will serve as Impact's co-chair. Sam, would you please take a moment to pop on camera and introduce yourself?
Sure. Hi, everyone. Sam Byers, and I am the interim adult behavioral health director. So if any of you worked with Jesse Benet, that is the role that I'm filling. Happy to be here, happy to do the work with all of you. Just in terms of a little bit about my background, I was managing the policy and planning team at behavioral health at OHA. Prior to that, implemented programs, and then had come from CODA, where I did quality improvement and assurance, and then also directed their residential and withdrawal management services, and spent a lot of my career in child welfare. So anyway, happy to be here, happy to answer any questions, and really just here to participate as much as I can, but listen and learn to the rhythm of this meeting. So that's it. Thank you.
Thank you, Sam. Again, welcome to the Impacts GRC. We are thrilled to have you here, and we really look forward to working together with you. I think you'll bring a lot of value to this team. All right. Well, on that note, we'll go ahead and pause to take roll. Since we do have those action items on the table today, we want to make sure that we achieve quorum. We will go ahead and start with co-chair Samantha Byers. Sam, if you want to pop up and just say present, that would be great.
Sorry, my Teams is like delayed here.
No worries at all. I got you down. Co-chair Ken Sanchakran.
Present.
Jeremiah Stromberg.
Here.
Judge Shanti.
Present.
Liz Weber.
Present.
Steve Gunnels.
Present.
Eric Swallow. Okay. Chief Harden.
I'm here. Good afternoon.
Afternoon. Commissioner Hall.
Present.
Alicia Beamer.
Present.
Stacy Brubaker. Dr. Brigham. Okay. Sheriff Landers noted that he would be absent. Dr. Stanfill. Okay. Senator Gelser-Blumen. Janie Gullickson. RJ Navarro. And Jaron Riddle. right. Avery, did we get you quorum?
Yes, we have quorum just exactly.
Okay, great. Well, hopefully have some other folks hop on but yeah, looks like we are good to go for now. So on that note, I will go ahead and stop sharing my screen so that Zach Thornhill from OHA can take over and give us a legislative update on what's going on in session for OHA.
Yeah, hi everybody. Zach Thornhill, and I'm one of the policy analysts with the intensive services team at OHA. I work primarily on civil commitment projects. So the folks that we serve and the folks that this grant serves are most likely one and the same. Let me share my screen here, and I'll provide just an overview of some of the bills that are going through, and give you some slides that you can take with you as well. So here you'll just see these are I just want to thank our government relations folks for actually providing these many of these slides for us. But just some of the legislative themes that are happening right now with with OHA in this session. I'm not going to read through these, but you have access to the slides afterwards. Yeah, want to make sure we have we're advancing our efforts to end health inequity by 2030 at OHA. Hold on now. Just one second. My slide, they're not advancing. Let me. One second. Maybe my settings are a little off. And apologies. There we go. Okay. And this should work, I promise. Technology was still 3 years in, right? Okay. Yep, there we go. All right. So one of the big pieces of legislation we have is the governor's budget. So that's Senate Bill 5525, but it maintains the existing investments, which were plentiful in the last couple of sessions, but it will add to that some monies for civil commitment and jail diversion, some work with the state hospital and discharges for folks who are at risk of homelessness, some harm reduction, mobile crisis, suicide prevention, child and family services, including residential, and of course, workforce development efforts. So in that bill specifically, it does have $70 million for new behavioral health investments. A big chunk of that is about $10 million for the CMHPs, our community mental health programs around civil commitment programming, primarily focusing on sort of the high risk or high utilizers and prevention efforts and outreach, as well as bringing jail diversion to the 7 counties in the state that don't currently have it. It does provide money for behavioral rehabilitation, as well as transition case management, like I mentioned, for those folks at OSH at the state hospital, and then the influx or the infusion of funds for children's psychiatric residential treatment. So it's currently in Ways and Means, but it provides additional funds for the Behavioral Health Coordination Center, which will be able to centralize sort of the bed capacity for inpatient and residential treatment facilities for behavioral health treatment. Provides funds for APD, adult and people with disabilities, for long-term care facility education around behavioral health. And there's a healthcare provider incentive program that's out of our health policy and analytics division, but they will hold those funds and administer the program that works on workforce development. Increase, I think it's about 15 million, if I remember correctly, for substance use disorder facilities. And then a lot of some funds for child and adult suicide prevention, intervention and postvention efforts. So I know that I provided an overview, gosh, I don't know, 3 months or so ago for you all around, or in January, around some of the bills. So I tried to provide just updates on all of those. But some notable ones, so House Bill 2544 is going to increase statewide capacity for licensed residential facilities. So this is something that we definitely and desperately need in the state, as I'm sure many of you know. There's some money for the CCBHCs, the Certified Community Behavioral Health Clinics, to expand that across the state. And so I'm not going to read each and every one of these just for sake of time, but one that CJC did sponsor is the Juvenile Justice Policy Commission, right? Y'all sponsored that, correct? Okay, great. And 2542 is actually to establish a separate accreditation program for substance use disorder treatment. I believe that's primarily around peers. And then actually, I just put this one in now because the Lund report came out, and I thought it was timely. But House Bill 2890 is to direct the Department of Corrections to ensure that everybody can have substance use treatment while if they're incarcerated. And that is also in Ways and Means. Another crisis we have in the state is public guardians and public defenders, but there is a bill to bring public guardianship services to folks in the aid and assist program who are deemed unable. We have a bill for fentanyl possession, increasing those penalties. An interesting one is the next one, House Bill 2543. So it would require OHA to study the capacity of our community mental health programs to actually carry out the things that we require them to carry out every 4 years, which is, it could be pretty illuminating. Increased funds to support folks up to age 21 with complex behavioral health needs. Incarceration is noted as one of the risk factors. And then Senate Bill 432. But this would require OHA to involve peers really in the planning and decision making regarding behavioral health services that would specifically serve them. And then there's one bill that has been signed so far that's notable. House Bill 2329 does modify the Declaration of Mental Health Treatment, which is a pretty awesome tool. It could be a pretty awesome tool if we put some energy behind it, but this is essentially an advanced directive, a psychiatric advanced directive, but in Oregon, we call them DMHTs. All right, there's a real quick overview for you.
Thanks, Zach. Yeah, a quick thing. The Criminal Justice Commission, we actually didn't sponsor the Juvenile Justice Commission bill. That was a Representative Krupp's bill, but we are responsible. Like CJC was named as being responsible for setting up the new commission. So we are tied to it somehow.
Yeah. Yeah. Great.
Thank you so much. Do we have any questions from the GRC about the OHA legislative update that Zach provided? All right. Well, let me get my screen back up then. Thanks so much, Zach. Great, and I will hand this over to Will, and Will, I will advance the slides as you say. But Will is going to be providing our update on quarterly reporting from grantees from this most recent quarter, which was Q3, January through March of this year.
Thank you, Casey. And I just want to check one more time. Everyone can hear me okay? Perfect. So for the record, my name is William Ash Houghton. You're welcome to call me Will, and I'm a research analyst here at the Criminal Justice Commission. And what I have for you today in terms of updates on quarterly reporting are 4 tables spread out across 4 slides that will look at the demographics, the top diagnoses among the impacts clients, the connections to care and diversion services, as well as the services that are provided by local programs. And so what we'll start with is table 1, which looks at the demographic characteristics of impacts clients in the most recent 2 quarters. It is sometimes a challenge to understand those by themselves, so I did include the previous quarter as well, so we can make just a few comparisons. The first thing that I want to direct your attention to, however, is actually the bottom of the table. What you'll notice is that last quarter we served, our local program served about 330 folks, and in the most recent quarter that has increased to 450. And so as we go through these tables, what you'll notice is that sometimes you'll see an increase in just the raw number of people, but that can either increase or decrease a percentage depending on how that item is calculated. So just included both just in case there was any confusion. So if we look first at race, what we'll see is that there are really 2 rows here, 2 racial categories that are really driving the change here. And the first of these is just in terms of raw numbers are those who are identified as white. And what we see here is that we went from 178 in Q2 to about 249 in the most recent quarter. And so while the percentage didn't change very much, that is a substantial increase just in terms of people. And then another large driver here was the American Indian population, which increased from 67 in Q2 to 114, or just over a quarter, 25% of clients in the most recent quarter. In a few other cases, there were some slight declines. So we see for Black and African American, as well as Asian Pacific Islander, there were just a few cases fewer than the previous quarter. And if we look at the unknown or not entered row here at the bottom of this sort of race subpart of the table, what you'll notice is an example of all of the number of unknown cases did increase by 5. That's actually a much lower percent than we saw in the previous quarter. So that's one of those times where we have more people, but a lower percent. And so as we move to age, again, there are a few categories that are really driving the differences that we see from Q2 to Q3. And those are the 25 to 34 years of age category, as well as the 35 to 44 years of age. And in those cases, what we see is a pretty substantial increase in terms of the number of people served in the most recent quarter. And in the former case, 25 to 34 years of age, that is a larger, roughly 5.5 percentage point increase. But we actually saw a slight decline in the percentage for those age 35 to 44. So more people, but a smaller percentage of the whole. And then for the next two categories, 45 to 54, as well as 55 to 64, we do see increases in the number of people as well as the percentages that accompany those. If we look at gender, which is sort of midway down that first table, what you'll notice is that the proportions or the percentages didn't really change that much. We still see about 2/3 of the clients that are seen in local programs are male, and about 1/3 are female. In the most recent quarter, that was about 304 male clients, as well as 144 female clients. And then those who identify as non-binary, they saw a slight decline to 2 folks in the most recent quarter. And then when we look at disability status, we measure these differently. It is possible that an individual could have both physical disability as well as an intellectual disability or developmental disability. And so in those cases, we can't really accurately measure that with the reporting that we get from local programs at this time. So we measure those separately. And what we see is that, again, just about 5%, which was 22 people in the most recent quarter, reported a physical disability. And about 83 people, or 18 or so percent, just about 1 in 6, reported a developmental disability. And then the last thing on this table that I want to draw your attention to is tribal affiliation, which corresponds to the increase in the American Indian population we saw with the race variable. Here we also see an increase, more than doubled, to just about 24%, or just under 1/4 of the clients served in the last quarter had a tribal affiliation. Next slide, please, Casey. Thank you. And so table 2 here looks at the aggregated diagnostic groups. Again, diagnoses come to us from the local programs. They report the top 3 only, and they also report the number of people who have that particular diagnosis. And so this is an incomplete picture. And we get those diagnoses in a number of ways. We get them with their ICD-10 codes. We sometimes get a very specific ICD-10 code that has text associated with it. And sometimes we only get the text. And so what these diagnostic groups do is allow us to generate some sort of standardized categories that we can use to better understand the changes over time in local programs and the reported diagnoses among clients. And these come from SAMHSA. And so as we've seen previously with table 1, there are a few that have much more movement, we'll say, than others. And so we see some slight increases with anxiety disorders and bipolar disorders, as well as depressive disorders. But the biggest changes here come from trauma and stressor-related disorders, which saw a decline from 67 reported diagnoses to 45 in the most recent quarter. And that is nearly all post-traumatic stress disorder. So that's one of those times where what we get falls into another group. As well with schizophrenia and other psychotic disorders, which is inclusive of as well schizoaffective disorder, we see that that has increased from 30 reported diagnoses in Q2 to about 65 in the most recent quarter. And then these last two, methamphetamine use disorder and then substance use disorder, if it was not more specified than that, we saw very slight declines. And the last thing on this table is dual diagnosis, and that measures those clients who have both a mental health as well as a substance use condition. And that is about 217 people, which is an increase from Q2. And I'll do the math for you. That's about 48.2% of Impact's clients in the last quarter had a dual diagnosis. Next slide, please, Casey. Thank you. And so table 3 looks at the specific needs of the Impact's clients that are served, as well as the number of people who were served in terms of that need, and then just a percentage of needs served. And again, because we have more people than last quarter, it is possible that the percentage may not change very much, or it may change rather dramatically. So just be mindful that the number served and the percent can both be helpful. And so if we take the first two of these, mental health and substance use treatment, which is what that TX is indicative of, we see that the need increased in both cases. And we also see that the number served increased in both cases. And so that leads to about 75% of the mental health treatment need being met in the most recent quarter. And then with substance use, although the number served did increase, it's about the same percent. It went from 57 to 55. And then in terms of peer mentoring, both the need and number served increased into Q3, which led to about 75% of that need being met. In terms of reentry, this pathway is slightly different than others. While the need increased, what we saw is that the number served actually decreased slightly, and so a lower percent of that need was met, from 62 down to 38. In terms of employment, both the need and the number served increased very slightly, going from 24 to 26% of that need being met. And then the last item on this table is related to housing. And you'll notice that the need is the same for both items. And that is because it is very plausible, and indeed it is reported by local programs that an individual can receive both transitional housing and a more permanent housing placement within the same quarter. Perhaps it starts as a more transitional housing approach, and then permanent housing may become available. And that can all happen within a 3-month quarter. And so we just want to be mindful that we don't inadvertently double count. So we just measure those separately. And so as we can see, about 35% of that housing need was met with a transitional placement, and about 28% was met with a more permanent housing placement. But again, some of those individuals may have received both services in the same quarter. Next slide, please, Casey. Thank you. And finally, table 4 here looks at two things. It looks at connections to care as well as diversion services provided by local programs. And so in terms of connections to care, OHP, Oregon Health Plan eligibility screenings, if we look at all 3 of these quarters, have really increased over time. And assistance with OHP enrollment has remained relatively steady. It's not something that individuals need to do every single quarter. Sometimes they may be incarcerated for a longer period, and that requires that their Oregon Health Plan eligibility be terminated for a short time, and then they can re-enroll, for example, as they re-enter from an incarceration. And so this number still is steady, right? 41 in the most recent quarter. And then in terms of case management, what we know from local programs is this is a very commonly provided service and a very strong need among local programs. And so as we can see in the most recent quarter, there was an increase in those services provided to about 263 clients, which is over half served in the last quarter. Now, the second section of this table, you'll notice an asterisk and you'll notice a note. And so I do want to take a moment and just explain for the benefit of those who may not be following this as closely, what is happening here. And so this community diversion service item, I'll get to very briefly. But first, criminal justice diversions. And so what this item measures is the number of times a person who is at high risk of being incarcerated was provided some type of diversion service to prevent that incarceration. And so although this is measured as a frequency, this is also the number of people. So one individual could receive this service more than one time in a quarter. And so as we see, it's still very steady and has increased from Q2 into Q3. And so as we come to the item with the asterisk, the community hospital diversion services item, this very similarly is anytime a person at high risk of hospitalization is providing services in an effort to divert them from community resources like the emergency department. And so originally in Q1, this number was much lower. If you were at the last grant review committee meeting or you looked at the annual report towards the very beginning of this year back in January when it was published, you'll notice that that number is significantly lower. It was about 100, just over 100 items or events. And so whenever we got Q2 reporting in and saw such a drastic increase, we reached out to local programs to better understand that change. And in some cases, it absolutely was. We're able to serve more people and have a greater reach than we did before. But as well, there were some reporting changes in this item. In some cases, it was being measured at the local program level as a number of people versus the number of times that it happened. And so, as I mentioned earlier, one person could be diverted multiple times. And so we asked those affected local programs to provide us with a more accurate reporting of the work that had already taken place in Q1. And so what you see here before you, this 439, is a more accurate reflection of the work that took place in Q1, but it is a greater value than you would have seen at the last grant review committee meeting. We also updated the annual report with this information. So if you haven't seen it since January, it is updated now. And in the most recent quarter, we see a very slight decrease from Q2, but still over 900 diversion service events. And the very last thing is this local impact staff assist law enforcement. This measures the number of times that a member of a local impacts team assists someone in law enforcement, either with an impacts client or with someone else who is very high risk. And again, we see a very steady line. There was a decline from Q1 into Q2, but it has since began to increase again in Q3 at 133 events. And so I will pause here for questions before I turn it back to Casey.
Alicia Beamer, I saw that your hand went up.
Yeah, thank you for the great report. I just wonder on this, with the diversions, you have for the case management, I'm just trying to figure out the correlation, especially with the diversion from jails and the hospitals going up so significantly, but we're not seeing the case management provided aligning with that. So how are they helping folks divert from these services if they're not providing case management? Is it through community health workers or peer support or something else that's defined a different way? It'd just be really great to be able to identify what resource is helping to divert. Thank you.
Absolutely. Absolutely. Thank you so much. I do want to mention that there are a lot of specific events that are also counted as diversion services. And so that determination had been previously sort of at the local program level, but with the updated reporting, I think we'll be able to better answer your question with the new reporting tools.
If I may hop in too, Will, I think here, Alicia, what's really interesting is that compared to the number of clients, which is what you're seeing in the connections to care, we are looking at like number of instances, frequency for the diversion services. And when Will and I touch base with some of the grantees, some of those diversion services defined by grantees were as simple as, you know, a phone call made to another, you know, entity to make sure that this person was connected or en route, you know, and that counted as an act, like a service provided that counted towards diversion overall. So there could be very small, you know, services in that way, and that's probably why the numbers are reflected in this instance. But Will, do you mind elaborating a little bit on how this might be changing with like how it will be captured in REDCap? If you know, it's also possible that we might just need to wait.
I do think that REDCap should have the ability to track these things as they're happening. And so rather than sort of an individual counting, you know, I talked to this person so many times, that data should already be reflected in the new tool. And so we can then on the back end, I think, get a better understanding of what specifically these count to. Does that help?
I think so. I think too, I've noted some things down, Alicia, that we can maybe touch base on the next time this section of quarterly reporting comes up. Especially it'll look a little bit different next quarter as the REDCap database rolls out and grantees, transition how they are reporting to the CJC on this type of stuff. But we might be able to go into a little bit of a deeper dive to what these look like and maybe take a look at more of an individual, de-identified, but an individual level of, maybe there's a couple of folks that are receiving a lot of these diversion services that are kind of outliers.
Yeah, great, thank you.
Are there any other questions for Will? Well, he'll be here the whole time, but in case anyone wanted to talk more about data. Great, well, thank you so much, Will, for walking us through that. I appreciate it. Go ahead and move forward here. Okay, so the agreement amendment requests. Wanted to give everyone a quick refresher on this amendment review and approval process. So approval from this grant review committee is needed when an amendment request exceeds 10% of a program's total grant award, or when the amendment request makes a substantive change to a program. So like a big programmatic shift that would need to be considered, like, hey, is this still within the spirit of impacts? That sort of thing. It also could be a combination of those two. These agreement amendment requests are accepted once per quarter as part of our quarterly reporting process. And sometimes we receive none, and other times we receive one or two. And today I have two to present to you all. So as I mentioned, if it exceeds 10% of the total award or makes a substantive change to the program, we bring it before the GRC for review, discussion, approval. Otherwise, requests to reallocate any portion of grant funds that is 10% or less can be administratively approved by CJC staff. So we have two requests to review this afternoon. Once I have presented the details for each one, of course, questions are always welcome, and we will take a moment to pause for public comment before moving forward with discussion and action on these two requests from the GRC. So are there any questions about the process before we hop in? Okay. So up first, we have Clackamas County request. Please note that there was a minor adjustment made to the specific agreement amendment request yesterday. And what you see on this slide may look, slightly different than the original request, which was included with the materials. They previously requested $256,000 and change to be reallocated due to a reassessment of their actual need. It turned out it was actually a lower request, so $207,000. That's still $207,750, excuse me. That still exceeded 10% of their total grant award. It's right about 29.33% of their total grant award. And that's why it is brought before the GRC today. So what they're hoping to do is reallocate that $207,750 to add an additional 1.0 FTE case manager position. These funds would be coming from a dissolved contract with OHSU. For those of you who are not familiar with the Clackamas County grant program, in the first grant cycle, 2020 through 2022, they had contracted with OHSU as a research partner to help them build like data infrastructure in order to collect client level data for impacts, case management system, kind of like a database. I'm not, super techie myself, so I won't be able to get into the specifics, but that was the plan. And then as Will and I were kind of mentioning during his report on the quarterly reporting, and as we'll probably discuss a little bit over the next several months, the CJC is also contracting with OHSU at this time. And we have asked them to, help us kind of look at this at a de-identified client level aspect as well. And that is called the REDCap database, and it will be available to all grantees to use. So, Clackamas County basically revisited the idea of this contract and thought it wasn't really necessary to carry on into this current grant cycle. And therefore, the contract is dissolved, and they have $100,000 to which they wish to reallocate to another purpose. They also have cost savings from a vacancy in their peer mentor position. Just from the last 3 quarters, they've been unable to fill that position. So they have a little bit of wiggle room there, $107,750 for that total of $207,750 that they are wishing to reallocate to create this new case manager position. It's also, I think, noteworthy that their number of impacts clients has grown to a total of 78 individuals. So the addition of this case manager would help Clackamas County serve impacts clients in a greater capacity. Are there any questions about this request before we move on to the other agreement amendment request? And as a reminder, there will be space for public comment before action is taken on these amendments, and we kind of circle back as a GRC to have any in-depth discussion or create action. Dr. Brigham, hi. Welcome. Welcome. Sorry that we didn't get you in earlier, but I got a message from Avery that you had joined, so we are definitely for sure at quorum now.
Thank you for that, and I'm sorry to have to join late. I have a conflict at this time. So I just had a question if there's further information available about the use of $207,000. That sounds a little high for just salary and benefits. Does it include other costs associated with that position, or is there any further information?
Yeah, so the information that was available was that this would be for about 1 and I believe five more quarters. So 1.25 years, salary and all fringe benefits. The original position for 1 year, we budgeted, or excuse me, Clackamas County had budgeted $200,000, and that was previously approved for their existing 1.0 FTE case manager position. So this one, and that was for, yes, that's their existing position. And this one is basically going to start now and then go through June 30th of 2024. So it does include all of the fringe benefits, but that is the information that I have.
Okay, that makes sense. It's for a longer time frame than I was thinking. So
let's see, Co-Chair Byers.
And I apologize. How many case managers do they currently have?
1.
And so they would have a total of 2 for the 78 individuals being served right now.
That's correct.
And they're still down a peer position within that.
Yeah, they're actively recruiting, but that peer mentor position is still currently vacant.
Okay. All right. Thank you.
Mm-hmm. Judge Shanti, I also see your hands up.
Well, I was just, so it probably doesn't matter, but what are they doing then? So they had OHSU that was helping them set up this whole tracking and data collection. And now that they don't have them, what are they doing to get the data and track it? Because that's important information, isn't it?
Oh yeah, no, that's vital information, especially figuring out how a program is performing. They did set up a, basically like some sort of database with OHSU over the past 2 years. It was a continued contract into these next 2 years for continued technical assistance and build out, as my understanding. But now all impacts grantees, all 15 grantees are going to be moving towards the REDCap database. And so basically they've been working with us and with OHSU's PSU School of Public Health Dr. Waddell's research group. You might remember them from a couple of months ago talking about this data shift. But we are actually moving towards that for a rollout of July 1st. So by the time next quarterly reporting is due on July 25th, we will have worked with all grantees to kind of transition to that client level data tracking system. And Clackamas County has actually been one of their pilot testers. So they've been working on that for a while now. Does that answer your question?
Yeah, very well. Thank you.
Great. Are there any other questions before we pop over to the next agreement amendment request? And then as a reminder, we'll pause for public comment before circling back for action on these two agreement amendment requests. Okay. So this next agreement amendment request comes from the consortium of Umatilla and Morrow counties. So they are one of the newer grantees to our group added in 2022. This specific request was about 15.1% of their total award, and it is a slight strategic programmatic shift due to hiring challenges that they're experiencing. It's, you know, kind of a classic story. And everyone is well aware that there is a shortage in the behavioral health workforce, especially for QMHPs. So they have given it a go for about 3 quarters now of trying to recruit QMHPs to serve at the community counseling solutions in Umatilla and Warren counties to serve this impacts program, and they have just not had luck. So their team went to work and they put their heads together to kind of figure out how they could reclassify the positions to still perform the duties as originally conceptualized, and how to do so without requiring a master's degree. So they have these funds, $93,840, coming from that cost savings due to reclassification of 3 positions. The positions were a supervisor that is now being reclassified to a peer supervisor, a peer mentor, which has been reclassified to a peer support specialist, and a skills trainer, which has been reclassified to a peer navigator. These positions no longer require master's degrees, therefore they have a lower pay scale that is associated with them, and that is what brings us to this like surplus of $93,840. So what they are requesting is to reallocate those cost savings from their personnel category to fund a couple of different things. First, 2 vehicles for staff to provide services to and transportation for the impacts clients exclusively. This specific program is all about getting out into the community and meeting clients where they're at, not necessarily trying to get them to come into the community counseling services clinic for services, but instead connecting with them by transporting them to a doctor's appointment or getting them services or bringing them to treatment, taking them to the pharmacy, those types of things. Community counseling services, community counseling solutions, the entity that's helping run this impacts provided services, they do currently have a couple of agency vehicles. However, they are being used for different grant program services and are generally not available. In addition to that, you know, they are unable to ask their staff to transport clients in their personal vehicles due to liability reasons, as well as a pretty high supplemental insurance fee if, you know, folks were to have clients in their cars. There's also accessibility to be considered. Not every personal car is the most accessible thing. I know I drive a Jeep, and that would be pretty hard to transport a whole bunch of different clients around in my personal car. So what they are looking for are 2 agency vehicles at $28,000 each. It would be owned and operated by Community Counseling Solutions. And these would be, again, used for impacts clients exclusively to provide services to those folks and transportation for those folks around the spans of those 2 counties. In addition to that, these new staff, the peer supervisor, peer support specialist, peer navigator, are definitely kind of thought of as mobile workers, although they're coming into the office and will have the home base of the Community Counseling Solutions like office. They will be out in the community transporting folks. And for that reason, they think that laptops will be more viable than stationary computers so that folks can have access to that on the road. They also are asking for printers, associated cell phone bills, and fuel for those 2 cars over the next 5 quarters. Crisis intervention training for those new hires, pretty critical for those types of positions. And then housing assistance, since they have really assessed that housing continues to be one of the greatest barriers to folks in their community working towards stability. So these housing assistance funds, the $26,000, would be going towards things like housing vouchers, temporary shelter, deposits, rent payments, and other efforts to get folks into stable housing. Let's see. So that is the reallocation request. Are there any questions from members of the GRC about this request before we pause for public comment? All right, I'll go ahead and skip ahead here for that public comment space. If you are joining us and you are a member of the public who wishes to comment, you may do so now. Please feel free to use the raise hand feature on Teams, or alternatively, if you're on the phone, just unmute if you're joining us via teleconference. I'll go ahead and create some space for this just as folks digest all of those amendment request bits that I presented on. Okay, I am not seeing any raised hands or hearing anyone pop off mute, so I believe we will go ahead and move forward to discussion and action regarding these 2 amendment requests, the one from Clackamas County and the one from Umatilla and Morrow counties. I can turn it over to the co-chairs and members of the grant review committee now for discussion and action. And hopefully we would move towards a motion and deciding whether or not you all approve these 2 requests.
This is Greg. When we're ready, I'm prepared to make a motion to approve. I assume we would vote on these separately, but that's would be a point of clarification. If so, I would move to approve the Clackamas County request.
Judge Chauncey, I did see your hand up. Did you have a comment?
Well, it was a comment or a question about the Umatilla one. So if we've got this motion, we can deal with the Clackamas and then maybe move to the Umatilla. And I'll go ahead and second that motion.
Co-Chair Byers, I do see that your hand is raised.
Yeah, I mean, this is just a question for everybody. I'm not opposing, but just thinking of the model where you'd have 2 case managers, which would definitely help the 78 folks that need that service. But then the struggle to find a peer, I just, I wouldn't oppose it, but is that viable for those case managers to do everything that's now going to be needed? Still missing a peer on this model. And I don't know. So I would trust the, my colleagues here to know that.
My thought on that is that each of the grantees were somewhat unique in their models. Like, we don't have a really standardized approach. So the way I've looked at it is we're kind of dependent on the grantees to, inform us of what would work for them. But it's a good question, but I just personally don't feel like there's enough standardization to really respond very well to it.
That makes sense. I mean, understanding the workload of both case managers and then not having the peer that can really get out there and track folks and stuff. I just, like I said, I wouldn't oppose it, but, and I love seeing case managers and peers, but just, how much they can really do as their numbers increase was just the reflective part of it.
Judge Shanti?
I think those are good cautions or comments. My observation of this process over the last, I don't know how long we've been doing this now, is that each program is fluid, and what they start out with their idea, they run up against roadblocks that they didn't know they would have. For instance, you can't get a peer, you can't get a peer. And so what I've found myself doing is paring back on my expectation of, are all these pieces going to fit together and work as efficiently and effectively as we want them to? And what I see is people are pretty good at patching things and trying different avenues to get where they need to go. And in this case, maybe at some point in the future, a peer will pop up, or a program that provides peers will pop up. So our decision making, at least from my perspective, it just never works if we want everything in place in the best possible way, because things are always falling apart and we won't make any forward progress. So those are really good concerns, and I'm always concerned about the effectiveness and efficiency, and is this really going to work? And it's kind of in part a hope and a prayer that the people that are on the ground will scramble and figure out ways to make things work when those pieces fall apart, or they hit the wall that they didn't see because they thought if they had the money they would get the resource. And it's pretty remarkable, really. All these years everyone's waiting for the money, and now the money comes and lo and behold, there's not the resource. And so it's just a fluid thing like that. And so I'm comfortable with supporting this, knowing exactly what you just said. How is that really going to work?
Thank you for your comments, Judge Shanti. I do think it's, worth noting too that Clackamas County is not intending to abandon their recruitment of the peer mentor that is yet to be filled. They just have 3 quarters worth of vacancy savings from quarters 1, 2, and 3, July 1 of 2022 through March 30th of 2023. That is sitting unused right now, and they're going for another case manager, and we'll have 2 recruitments open if approved. Well, I believe we left off with a motion from Dr. Brigham and a second from Judge Shanti. Is there any further discussion? Okay, then we'll go ahead and proceed to a vote. Co-Chair Byers, we actually do a voice vote here to kind of speed things along since this can be a large group at points. So I will go ahead and repeat the decision before everyone now. It's whether or not you approve the amendment request from Clackamas County as presented. And here I will ask for any folks who abstain to please make it known before we move into the actual voice vote. Okay, I'm not noting any abstentions. So all those in favor of approving the agreement amendment request from Clackamas County, say aye.
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 Thank you. And those opposed, please say nay. Okay, great. Then that motion passes and the agreement amendment request for Clackamas County has been approved. We can go ahead and move on towards the Umatilla and Morrow counties. And Judge Shanti, were you saying that you had a comment about this one that you wanted to start off with?
Well, yeah, I was hoping someone from the committee that's been on it a while can refresh me. I know early on, we were not voting positively to support the purchase of vehicles. We thought that, well, what happens when the grant's done? Then where does that vehicle go? And is that a wise use of this grant money? But if I have some recollection that over the course of time, we've kind of modified that position or that concern. I can't remember if it was that we had conditions about what would happen to the vehicle if the grant was gone, or I really just can't recall. So I was hoping someone might recall for me that thread, since I only remember the beginning of the thread, not where we are with it now.
This is Jeremiah. I don't recall us putting conditions on it, but I do know that we have historically been hesitant to approve significant amounts on let's call it supplies and equipment. So I know what I was going to ask along that similar line, and Casey, I apologize if you did clarify it in your explanation. But in the original application, did we already approve certain supplies that in a similar fashion for Umatilla and Morrow? Could you clarify for me?
Yes, thank you. Had to find a way to get off mute there. Thanks for your patience. Okay, so as part of the original application from Umatilla and Morrow counties, there was no vehicle request in terms of equipment. And this grant, like many of the other grants with CDC, do have that different threshold. Equipment, something, you know, greater than $5,000 or lasts longer, has a life longer than more than a year. Supplies is under that threshold. So they had several things. See, I'm trying to figure out here. Yeah, several things under supplies, or excuse me, that might count as supplies, like, you know, other travel and gas, and like clothes, employment assistant, daycare, those sorts of things. However, no previously approved cars or anything of that type. I think that the original idea for the supervisor, peer mentor, and skills trainer positions, those three original positions, were to be more like on campus in the clinic, people coming in to community counseling solutions. And since those, you know, the QMHP positions basically could not be filled, that's when they rethought and are now thinking, let's get out into the community more.
Thank you.
So I just wanted to comment that my memory is the same as Judge Shantae's, that in the first round, there were requests for vehicles. And in the review process, there were a number of things like that where they hadn't been anticipated. Discussions went a certain way. Sometimes we didn't allow things. My recollection is we didn't allow vehicles in the first round. I don't recall whether that was ever changed in the subsequent round or if there have been other vehicles purchased with impacts money. I personally don't have a problem with, making this kind of resource available to grantees, but there may be, accountability kind of factors I'm not thinking about. But there's also the issue of if we have not approved them up to now, just consistency wise and fairness wise, whether we would do that. I was hoping someone on the call would know as well whether, we have approved vehicles since that first round.
I could jump in really quick. I think Dr. Brigham and Judge Shanti, your recollections are correct. That in the beginning, we really tried to stay away from vehicles. Where vehicles did come up, it was about mid 2021 when our grantee CT Clusi, they wanted to reallocate funds and included a vehicle in that ask, and it brought about a lot of debate. I think we actually had a couple meetings over this and talked with the tribe as well. And I think in the end, when we did approve that, a lot of our focus was really on that need, especially that the tribe was able to articulate in that they serve a very large geographic area, and that to be able to reach very remote, isolated individuals, that vehicle was necessary. And so I think that was really what we focused on there when we established, I guess, a new precedent, at least with these amendment requests. And so I know that when I was listening to the proposal that we have right now, I was really pleased to hear how much the focus was on how this vehicle fit into their programmatic needs and how it really fit into the model that they have. It sounded very similar to me with what we heard from the tribe back in 2021. And so that's the background that I at least could dig up and recall, because I had the same fuzzy memory. So I've just been searching furiously in my email. I don't recall us putting any guardrails, though, on that vehicle usage and contemplating post-grant or anything like that. But that, I said, my memory's fuzzy, so I may not recall that piece. But I think their ask was for around 43,000 for a vehicle for their police department. So I think it was a slightly different type of ask, but that's the one that everybody is kind of remembering who's been around for a little while.
So just to follow up on this vehicle thing, and thank you for bringing that up because it did spark my memory once you started talking about it. In this case, and I guess this is kind of an overview of how my thinking about how to serve this population that we're trying to serve through these grants has developed over time, and that is this. I've come to believe that the best way to serve these folks is to get out into the field and meet them where they are, because this idea of like telling them they have an appointment at 3 o'clock on Thursday, 3 weeks from now, it's just not going to work if you're unhoused, en masse, rolling around out there. You don't even necessarily know what day it is. And then the idea of coming in from wherever you are to meet the timeline, and then you get there and you're late, and the provider understandably says, we can't serve you. We've already got 5 other people now that are, being served. And so you get sent away. So to me, one of the things that I'm hoping to see is these programs that are actually changing their delivery system to get out into the community and to meet the people where they actually are. I'm hoping to see if that actually ends up increasing the benefit to the people we're trying to serve. So since we've already done it before, which that's what I was raising, this fairness issue. We've been, telling people no all this time. I'm in support of providing these vehicles for the purposes that they've said, that they're going to be out in the field trying to reach the people, as opposed to some other reason for the vehicle, which I remember we did have some other reasons that were offered early on when we rejected people, and it was more like they already had this program in place and they just wanted another vehicle or something like that. So with that, I would make a motion that we approve this request for a change in the grant money allocations.
This is Greg. I'll second.
Thanks. Is there any further discussion? Okay, go ahead and proceed with the vote. So the decision before you now is whether or not you approve the agreement amendment request presented to you today on behalf of Umatilla and Morrow counties. Here, I will proceed to ask for any abstentions. Please make it known. Not hearing any, so we'll move forward with the voice vote. All those in favor of approving the agreement amendment request for Umatilla and Morrow counties, say aye.
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 And those opposed, say nay. Okay, noted. And I did receive confirmation from Avery that we are still at quorum, so that passes. Great. Well, the next bit was just wanted to bring you all up to speed on some upcoming events for impacts. So in a couple of weeks, oh yeah, Dr. Brigham, hi.
Oh, sorry, I didn't necessarily want to interrupt you, but I apologize in advance if this has already been kind of settled, but I don't recall it coming back up. We had some additional funds left over from the last round, and I recall we had a discussion here. We actually got some requests for those funds, and in full transparency, Mike Douglas County, who I work with, was one of those who requested. I don't think we know the outcome of that. There was a discussion about whether to use the funds in that way or whether they would be used for further development of data systems and so on. And so anyway, if there's any update on that, I would be interested in knowing that so I can take it back to the lipstick when I go there.
Yeah, absolutely. I'll speak to it a little bit, and I'm sure Ken will want to jump in too. But basically, not much of an update to offer. We are waiting until we see how it ends up in session, figuring out, if the requests that have been made, if moving forward with those would be the best use of the unallocated funds. I believe there was, oh gosh, don't quote me now, 1.2 million of unallocated funds. That sounds about right. Ken, is there any comments you wanted to add?
Yeah, just building on that. I mean, I think that one of the things that we discussed at the last meeting, the staff put together kind of a flow chart of the different data systems and research work that's going on. I think that while we didn't hold a vote, I think the conclusion from that is that, at least from CJC's point of view, I think our data systems for a program of this type are now quite robust in what we're developing. And so most likely that's not the route that I would recommend that we take. But we are kind of in a holding pattern. We're waiting to see what shakes out with session and the budget asks that are out there. Another piece that actually fits in very well with what Casey was mentioning about our upcoming events. We also are expecting to have representatives from the governor's office at this event in Seaside. And a lot of that work is then going to be us as staff trying to communicate both the importance but also the unique space the impacts occupies between behavioral health and public safety. So we're going to have both advisors in those realms from the governor's office out to try to discuss maybe how this fits into the governor's priorities. And so our hope is to continue to develop some real motivation behind getting some additional funding, because I think that the program looks quite different if we are not successful, or if the legislative session is not as successful across the board as we're hoping. That changes our strategy and maybe how we would want to utilize those funds. And so I think we're just hopefully in our next quarterly meeting, which will be post legislative session, that's where we can discuss then the next steps for that funding, and we'll have a better idea of what the landscape looks like.
Thank you.
Thank you, Ken. Appreciate that. Yeah, but let's see. So upcoming events for impacts. In a couple weeks from now, gosh, yeah, it's Tuesday, so really just 2 weeks. Wow. We will be headed out to join the 2023 Northwest Regional CIT Conference. We have invited several grantees. I think we have a total list of, I believe it's 27 individuals from all different grantee sites that will be joining us at this 2-day conference in Seaside. It was a pretty unique opportunity to get the word about impacts out there to an audience of Oregon, Washington, and Idaho law enforcement and behavioral health workers that will be attending this conference. On that second day, Wednesday, May 24th, we are actually partnering with OHSU to host 2 impacts panels, one of which will be focused on reducing recidivism through community-based programming, and will feature several of our county grantees. And another will be providing culturally responsive services, which will be more of a tribal grantee-based panel. And we are really excited to have, nearly 3 hours to showcase all of the amazing work that impacts grantees are doing and how innovative it is. As part of that conference, we are hosting a half-day impacts retreat for impacts grantees. This will be a great opportunity for people to meet in person for the very first time since this program started, which is wild to think about, but we are thrilled that the opportunity is finally here. So we are, again, partnering with OHSU and the Waddell Research Group to share basically a rollout of the REDCap database, make sure that grantees have ample opportunity to dig in, ask questions, share concerns, and take a look at, what this change in data reporting will look like, and how it will really benefit how we tell the story, the impact of impacts, if you will. We also, as Ken mentioned, have invited members of the governor's office to attend this retreat. And we will be, just really using it as an opportunity for grantees to share all of the amazing work that they're doing, the successes that they have seen in their programs, the community partnerships that they've built, as well as the challenges, and maybe have an opportunity for connection and problem solving with other grantees that maybe have similar operations or perhaps something very different, and just a great learning opportunity for these folks. So that's what's going on this month. And also, as Ken mentioned, that next grant review committee meeting, the next quarterly meeting is scheduled for Tuesday, August 8th. So that will be definitely after session has ended. Probably have a better idea of what the landscape looks like out there, and be able to provide updates to you all at that time. Are there any questions for me or anyone else? Great. Well, thank you all very much for tuning in today, and for the great discussion that you all had. I appreciate it, and I hope you have a great rest of your week.
Thank you for your good work. Bye-bye, everyone.
Thank you.
Thank you.